Okay. Good afternoon, my students. Today you have lecture. Topic of lecture: pathological anatomy of inflammation. And for you in future, need of definition of inflammation, classification, mechanism of development of exudative inflammation. Why need it for you? It's important for your medical practice in future. And have different type of definition, but for you need a modern definition of inflammation. And for example, look at screen. Modern definition of inflammation. Inflammation is evolutionary, developed, protective, vascular, stromal, a systematic reaction of the body aimed at eliminating foreign antigenically and antigenically indifferent particles from the body by phagocytosis. In screen you look yellow fields. Why need its card? Because in this all words it's important. And fields need for recording of different words. For example, evolutionary, developed. What is it? Why need say about it? Then next word protective. Then vascular stromal, and have discussed about antigenically and different and indifferent particles, and phagocytosis, important words. What is it inflammation in evolutionary developed? If we discuss about evolution, during evolution formate different changes and improve of system of organism during evolution. For example, if you remember about different types of animals, and you remember about two-layer animals and three-layer of animals. But for example, if we discuss about who have phagocytosis, if present phagocytosis, present inflammation. No, but not all organisms or not all animals have phagocytosis. Only three-layer animals who in embryogenesis have three germs, ectoderms, germs layer, ectoderms, mesoderms, and endoderms. But for example, if you remember, who the first have three layers in what name of organism? If you remember, okay. And the first organism, it's for example flat worms, and for example planaria, for example ectodermis, and for example sea urchin, for example shift, for example star shift. In this have three layers, yes, and for example two layers organism, for example hydra, and if you have cut of hydra, absent changes, not format inflammation in organism. If we discuss about protective function of macrophage, for example, neutrophils, and this we discuss about present a lot of different cells specialization cells, for example, and non-specialization cells who can protection, ну как, have phagocytosis. For example, specialized cells, for example, phagocyte, macrophage, yes, and the protective, the special function, purpose of cells, protection of organism. For example, different organism, antigen, for example, xenobiotics, and protection of microbes, different microbes, and then we discuss about next word, vascular stromal. What is it, vascular stromal? If we discuss about inflammation, I'm show picture, different picture. If we discuss about phagocytosis, and vascular stromal, where localization inflammation? What you think? Where? Often a student answers me in blood. Why? In blood. Inflammation format in loose connective tissue. Fibrous connective tissue. If you remember, what format changes in tissue, what localization in connective tissue, in loose fibrous connective tissue, and this present different cells. For example, fibroblast, fibrocyte, and its cells need for build, yes, and present different another cells. For example, histiocytes. For example, macrophages, and its cells need for protection of organism, for phagocytosis. If and present another cells, for example, labrocytic, for example, basophilic tissue basophils, and mast cells. Its cells need from induced of inflammation, and but not format inflammation, only induced. And for example, this you look types of different and look different types of cells. And if we discuss about macrophages, this is group of all cells that have the ability to capture phagocytize from tissue fluid, intracellular space, foreign particles, dead cells, etc., and having monocytic origin. Macrophages are divided into three ones. For example, macrophages of serous cavities, peritoneal, etc., and fixed. For example, liver macrophages, macrophages in the organs of hematopoiesis. And connective tissue macrophages are histiocyte. Among them, there are antigen present in the macrophage, for example, dendritic cells of skin. And now I'm show picture. Now I have discussed about phagocytosis. If you remember where you study, and the university named of Ilya Ilyich Mechnikov, and scientist who study basis of inflammation and immunity, and have a Nobel Prize. Ilya Ilyich Mechnikov. And Ilya Ilyich Mechnikov wrote, I plucked some thorns of rose, this mistake, pink and rose, similar in Russian language. Pink, color pink, and floor rose. And if I discuss about rose, maybe rose rosary color, maybe rose flowers. In this instead, in this I have discussed about thorns of rose, and immediately inserted them under the skin of magnificent crystal-like water starfish larvae. Of course, I was worried all night waiting for the result, and the next day, early in the morning, I was happy to state the lack of the experience. This latest experience formed the basis of Fagacet theory, the development of which was devoted to the next 25 years of my life. This I have discussed about experience of Ilya Ilyich Mechnikov, and have discussed about basis of phagocyte theory. Yes, yes. And because if you remember, I told about three layers of animals. For example, you look picture where present different animals from two layers. For example, hydra, algae, pseudopodia present in this. Easily animals have two layers, and this present two layer. And this animals have inflammation, have phagocytosis, because present macrophages, present neutrophils, no, but differently named in the easily animals. Not, for example, if I discuss about different organisms. Not you have discussed about three layers of animals. You listen about starfish, for example, and I have questions about insect. For example, cockroach. Present or no? Cockroach, for example. Present inflammation or no? Yes, present, because insect is three layer of insect, no animals. In this present inflammation, because present cells cells similar with the macrophage of animals. For example, this you lose macrophage, histocytic macrophage different, and inflammation. For example, injury in this, and format changes. If now remember about what is inflammation. In this present on the screen you look to macrophage in loose fibrous connective tissue, and you understand no phagocytosis, no inflammation, and inflammation present only in organism who formed from three germ layers: ectoderm, mesoderm, endoderm. Inflammation is, I repeat about inflammation. Inflammation is an evolutionary developed protective vascular stromal develops in the connective tissue near the vessels, and systematic reaction in the body aimed eliminated foreign antigenically and antigenically indifferent particles from the body by phagocytosis. You understand what is it evolution, format during evolution, what is it vascular stromal, I repeat about vascular stromal way, Because inflammation need three parts. For example, bone marrow, next vascular, micro circulatory vessels, and connective tissue. Need connective tissue. Vascular stromal. I repeat. Questions for student. Where localization inflammation? And student answers me in blood. No, but it's not correct answers. Because inflammation format in connective tissue. But vascular need for transport of cells. For example, leukocytes from bone marrow. Как the first. Because macrophage meet with antigen and activated of substance, and substance have name cytokine. Cytokine. I'm show picture. Next picture. Так, phagocytosis. Format phagocytosis. This, for example, you read recognition of xenobiotic, foreign antigen, opsonization, plasmalemma invagination. For example, this you look. Protein binding, primary lysosome formation, fusion with the lysosome from the cytoplasm. For example, this you look. Outcomes in case of degustation, complete phagocytosis, or in case of impuissance of enzymes, incomplete phagocytosis. With complete phagocytosis, expression of xenobiotic antigens on the plasmalemma, production of pro-inflammatory cytokine, interleukin, TAF, TNF, factor necrosis of tumors, for example, and thrombocyte activity factor, for example, cytokines. And cytokine, what is cytokine? It's a substance, and its substance need for chemical message, for example. And these cytokines go in different for example, bone marrow, them in vessels, and in tissue, connective tissue. For example, in bone marrow, what changes in bone marrow? Sorry. Okay. It's macrophage with part of antigen, and in this present antigen and part and phagocyte is of antigen at a different xenobiotics, foreign body, for example bacteria, and part of antigen localization on membrane, and it's alarm for different macrophages, different and format changes. The first, in bone marrow, if cytokine plus in cytokine present oxygen activity oxygen and diet of antigen. For example, in this except oxygen activity oxygen present, for example, sorry, 1 minute. Present proteins, proteins who injury of cells. enzymes, and no, but important oxygen peroxides. For example, this you look, and injury and pro-inflammatory cytokine activated mobilization of leukocyte and bone marrow. In blood, you look a lot of leukocytes in blood, and a lot of young leukocytes. And this as answers on cytokines. Then the second address, macrovessels. In these expansions or due to blocking the sensitivity of smooth muscle cells, extend, increase permeability to plasma and leukocytes mobilized from the bone marrow due shrinking of the endothelium. From bone marrow, leukocytes go from sinusoids and then go in blood. Then in microvessels, and this increase permeability, and endothelium go endothelium from endothelium. Then present cells of microenvironment. Not, for example, this you look mast cells, whole localization in loose connective tissue, fibrous connective tissue. And this hemoattractation of leukocytes, and format activation of phagocytosis. If you look in this of screen, and this you look 5 signs of inflammation, and this is important for your practical in clinic. Now, for example, you look tumor, from Latin, tumor. And this edema, because increased permeability for plasma and format edema, dolor, pain, rubor, this temperature, high level of temperature. Rubor is color is red because vessels is increase. And color is a high level of temperature, and function liaison. And this changes function, injury of function format. Not, for example, this you look. Why need macrophage? This constant of internal environment of organism. And then you look if cytokine, and then you look mast cells, and mast cells present granule with mediators, and then the format degranulation, mast cells degranulation format, and this you look name of different substance: histamine, heparin, serotonin, dopamine, and other factors. For example, histamine need for muscle spasm of internal organ. Or, for example, you remember about bronchs. Patient have bronchial asthma and this allergical reaction and format spasm of bronchs. No, but if you have discussed about vessels, this format vasodilatation. And after histamine, and discernible edema, format edema. Then heparin. If vasodilatation and slow down of blood circulation, this prevention of blood clotting, after blood clotting and thrombosis, and then serotonin, increase pain sensitivity and regulation of vascular tonus. Dopamine, and this neurotransmitter effect on the central nervous system. In this you look slow, and this immediate reaction. Slow lasts for days. Immediately anaphylactic, several minutes, for example. Taxis factors for eosinophils and neutrophils, attraction of granulocyte. Inflammation, for example, vasodilatation, anastasis, this increase of interendothelial space, for example, between endothelial site, for example, in this you look changes. Then I'm showing next picture. Okay, I'm show. Okay, I'm show picture about inflammation. And now you remember inflammation, evolutionary protection. Those you have discussed about macrophages and neutrophils, vascular stroma during vessels, way from leukocytes, yes, vascular stromal reactions. Then eliminated foreign antigenically and antigenically indifferent particles. And for example, if we discuss about antigenically, for example, microbes, xenobiotics, and maybe antigenically indifferent particles. What antigenically indifferent particles? Well, for example, this have discussed about, for example, surgery in organism. This, but this format opsonization on surgery, and phagocytes look and substance of format opsonization and this foreign body for our organism, and the delete of its particles. Then we discuss and continue. Okay. But for example, what changes? What for example, you look leukocytes, and leukocytes during from bone marrow, from bone marrow during from sinusoid go in blood vessels. Blood vessels. In normal leukocytes localization in center. No, but in this changes, format changes, leukocytes format parietal pool and localization around with endothelial cells. For example, this you look basement membrane present in this, and in this you look one layer epithelium, endothelial cells, endothelial sites. In this you look receptor, and in leukocytes present receptor, and if leukocytes connected with receptor of in endothelial site, this then leukocyte stops, and not, for example, this you look all receptor connected. And then for leukocyte need go in loose connective tissue, loose fibrinous connective tissue, fibrous connective tissue. For example, this you look. This you look connective tissue, and from intracellular transport, intracellular channels. There's injury of basement membrane, and leukocyte go in loose connective tissue, loose fibrous connective tissue. And for example, this you look, this part of in vessels, and part, the second part in connective tissue. For example, And next picture, for example, you look marginal standing in leukocytes and rolling. Rolling, for example, this process, if localization of leukocytes in around with epitheliocyte, and then format move in on endothelicytes, format rolling. And for example, this electronic picture photo. And this you look staining picture on microslides. In center of vessels you look erythrocytes. In this you look segmented neutrophils, leukocytes. For example, this you look extended vessels extended. If slow down blood circulation, because this you look full congestion vessels. And this you look electronic picture. In this you look 3 leukocytes, 1, 2, 3. In this you look vessels, wall of vessels, walls. For example, this part. And this you look part of vessels. In center of vessels present leukocytes number 1, and localization in center around you look a lot of erythrocytes, and this nuclei similar with lungs, and localization in vessels. The second leukocytes localization in part of in vessels. Them, for example, this you look part enduring from vessels, during from vessels. So injury of walls of vessels. And the second part, the second part, and in matrix go out from vessels. And the third leukocytes localization in matrix of loose fibrous tissue, not fibrinose. Fibrinose type of inflammation, and we have discussed about fibrinose after break. Okay, do you need break for my student? Maybe 5 minutes. Okay, 5 or 10 minutes. Write them please in WhatsApp for me. Okay. Do you need break? Write them please in WhatsApp. Not answers me. Why? You present in practical in lecture or no? In practical class, you write a small test control from a lecture. You have questions from from lecture. Small test. Okay, you write in me in okay, 5 minutes. Okay, okay, okay. 5 minutes you have break. Okay. If you have questions for me, write in me in WhatsApp or in YouTube. Okay. No, the better in WhatsApp because I'm look and answers on lecture. Okay. I'm writing in on WhatsApp. Questions if you have questions. Okay, 5 minutes break. Он вышел, он появится. Конечно, конечно. Перерыв.
Все получается, нормально?
Да, нормально.
Сколько у вас еще перерыв будет?
3 минуты.
И если что, тихонечко зайду, вам
Да, без проблем. Я просто звук не выключила, ничего не включила. Будет. stop of break. Continue with the lecture. Now we'll discuss about types of inflammation. Okay, I sent information in WhatsApp for you about stop break, and you don't have questions for me. Okay, in practical class I have a lot of questions for you. Okay, continue. Classification of inflammation. In this present two types of inflammation: exudative inflammation and productive inflammation. And maybe you listen about, or maybe you read about chronic and acute inflammation. No, but in pathological anatomy, the first need to discuss about exudative and productive inflammation. And if we discuss about chronic and acute inflammation, and this we discuss about clinical practice, acute, chronic, and subacute. Now, in pathological anatomy, you look in microslides and you look changes, because need to discuss about exudative inflammation or productive inflammation. Well, for example, if we discuss about exudative inflammation, and this phagocytosis is carried out mainly by neutrophilic granulocytes. In productive inflammation, phagocytosis is carried out mainly by macrophages. And depending on the causative agent, for example, the first infectious, the second aseptic, non-infections. Variation of the latter is demarcation inflammation. For example, I have discussed about surgery material, for example, surgery suture, for example, aseptic, non-infections, inflammation. For example, in infarction on heart, for example, maybe formed demarcation inflammation. And then I show next picture special forms of exudative inflammation. Next classification: catarrhal inflammation, for example, putreficate, ichorous inflammation, purulent inflammation, hemorrhagic inflammation, for example, picture. And I'm show picture of, for example, you look next. And exudative is carried out mainly by neutrophilic granulocyte. Fatty rose, fibrinose, purulent inflammation. I'm repeat. Sorry. Then I have discussed about chronic inflammation. Chronic inflammation, isolated by some authors, is not on an independent form, but a variant of cause of inflammation, in which both exudate, namely purulent and productive inflammation, can occur chronically. The latter is in most cases is chronic. Now, for example, abscess, maybe for chronic, maybe acute inflammation. For example, if we discuss about chronic inflammation, and this the better have discussed about purulent inflammation. Yes. For example, acute abscess, not format connective tissue around, not format capsule. If we discuss about chronic inflammation around with abscess, format capsule. The chronic forms of inflammation can take with insufficient phagocytic activity of leukocytes or other disorder of the immune system. That's the first. The second, with low antigenicity of pathogen, or the third, with the continued entry of pathogen into the tissue. For example, microbes into open wound. After surgery operation, for example, and problem with surgery material, maybe inflammation, bigger inflammation, and wound open, and the microbes from external environment go in the wound, for example. The isolation of chronic inflammation as a special form is advisable from the standpoint of clinical practice, since it means of the inability of the body on the reason or another to deal with the problem on its own. And for example, we discussed about chronic inflammation. And then we discuss about cirrhosis, fibrinose, and pure inflammation. Exudative inflammation. Exudative inflammation may be, if we discuss about pure chronic and acute. And in the beta, I discuss about only exudative inflammation in pathological anatomy. But for example, cirrhosis inflammation. If you remember, structure of vessels, and have discussed about increased permeability of vessels, and plasma go in tissue around these vessels, and because in this present protein in exudate, but and you look number of protein, and mainly albumin, and leukocytes are long, few leukocytes in cirrhosis exudate. If we discuss about fibrinose inflammation, this fibrinogen out part. For example, this present types Krupose divided two parts, subtype. For example, Krupose inflammation and diphtheritic inflammation. Krupose inflammation in this format layer of fibrin, and localization in one layer epithelium very often. And one layer epithelium, for example, have discussed about heart, and have discussed about fibrinose pericarditis, for example. Then have discussed about diphtheritic inflammation, and this format layer with fibrin, for example, in multi-layered and high relief epithelium. And then I am showing a picture with Krupose inflammation. For example, if we discuss about fibrinose inflammation, maybe formatted different organs, for example, in lungs, Krupose pneumonia, for example, maybe, for example, in heart, Krupose fibrinose pericarditis, yes, and another. And diphtheritic inflammation, for example, in this format inflammation in colon, diphtheritic inflammation. If we discuss about purulent inflammation, there's a lot of white blood cells, there's a lot of neutrophils, and more proteins. For example, you look 8 to 10 proteins percent and need differentiation between, for example, cirrhosis and cirrhosis exudate, between transudate. In transudate, few protein, and crystal, color is crystal, and cirrhosis this more protein, this more. Continue, okay? Purulent inflammation. In this, I discuss about types: phlegmon, abscess, and empyema, for example, and different types of purulent inflammation. Very often you meet phlegmon, abscess, and empyema. Empyema, in this you look pus in whole organs or maybe cavity of body, empyema. For example, empyema of pleura, for example, name of diseases, and maybe if we discuss about phlegmon, this not limited inflammation, purulent inflammation. For example, phlegmona of skin, and divided two parts, hard and soft phlegmon. If present necrosis, this format soft phlegmon. If absent necrosis, hard phlegmon. Abscess and limited purulent inflammation. Limited purulent inflammation, and in this present acute, I told about it. Acute and chronic. Abscess limited, and for if we discussed about acute abscess, not format capsule, only format young connective tissue in the letter. No, but if we have discussed about chronic abscess, and this format capsule from connective tissue, adult connective tissue. This need differentiation between phlegmon, not limited purulent inflammation, abscess limited. For example, abscess may be localization in different organs. For example, in brain, in lung, and maybe liver, maybe kidney, different organs. Maybe localization abscess. And PMA localization in the whole organs. For example, appendix. For example, tubes. Maybe cavity, pleural cavity. For example, and another. And maybe I told about cavity. Okay. Then special forms. Catarrhal inflammation is distinguished on the mucous membranes, characterized by hyperproduction of mucus. This is not special form of exudate. For example, cirrhosis, catarrhal rhinitis, or purulent catarrhal bronchitis. Very often mixed cirrhosis and catarrhal, purulent and catarrhal, for example, very often mixed, format mixed. And have discussed about putrefacitive or ichorous inflammation. In cases where anaerobic microbes, Clostridium infections, that enhance alteration multiply in necrotizing tissue, and there are practically no neutrophils leukocytes. These few leukocytes, since the mechanism of their attraction and delivery to the necrosis focus don't work. And very often, if we discuss about ichorous, in this ichorous inflammation, for example, if we discuss about gangrene, for example, in future format very often in gangrene, gaze gangrene, for example, in future. Gaze gangrene, and this we have discussed about necrosis, special types of necrosis, but in future outcomes. And then have discussed about hemorrhagic inflammation. Is not a separate form which is characterized by an admixture of erythrocytes to cirrhosis, fibrinose, or purulent exudate. And then I'm show picture. What is it? Often students say me it's brain, not a brain. It's mucous membrane of stomach. This patient have catarrhal inflammation, and mucus. Next picture, cirrhosis inflammation. This patient have burns, for example. This in this you look microslides with the skin, and in this you look few leukocytes, and present exudate in this. Edema, exudate, present in this. This cirrhosis inflammation, and very often cirrhosis inflammation maybe mixed. No, and this is And very often, for example, serous catarrhal inflammation, very often just mixed it with, and serous may be self. Next picture, fibrinous pericarditis. And this you look heart, and this you look fibrin present in this synechiae, present in this. In future, outcomes is not favorable. And this may be format no problem with work of heart in future, because in this you look fibrin and colors yellow, greenish and dirty of, for example, this you look fibrin on surface of heart, for example, and this cut of pericardium, and this you look synechiae, or in future format synechiae, format connective tissue in this, and problem with work of heart. In microslides you look fibrin present in this on pericardium, epicardium. It's muscles of heart, and you look vessels extended, full, a lot of erythrocytes, congestion vessels, and few leukocytes, presently leukocyte in this, and edema. Next picture, diphtheritic colitis. And this you have discussed about fibrinous inflammation, and this types crupose inflammation, because it is one layer epithelium. Next picture, diphtheritic colitis. This diphtheritic inflammation. So if you remember about inflammation, for example, the first we discuss about fibrinous inflammation divided to part, crupose and diphtheritic. In diphtheritic, for example, this you look colon, and this present fibrin. This you look white colors, and in this you look mucous membrane, and this you look fibrin, a lot of leukocytes present in this. If you look at this, extended vessels was a dilatation, and congestion vessels, blood congestion. But in this you look a lot of lymphocytes, leukocytes, and plus in this you look in future. This is multi-layer epithelium. In future, maybe format changes, not favorable outcomes maybe format in future, and maybe format necrosis around tissue died in this in future. No unfavorable outcomes. If we discuss about unfavorable outcomes. Next picture, crupose pneumonia, and this discuss about fibrinous inflammation, the first subtype, crupose pneumonia. For example, this you look pink colors, this fibrin is pink colors, for example, this, and a lot of cells, different types of cells. Red colors is erythrocyte, there's a lot of erythrocyte. Plus, in this you look a lot of absent oxygen, and this a lot of different cells, of inflammation cells. Plus, in this you look neutrophils, segmented leukocytes, and you look walls of alveoli, and this you look a lot of vessels, blood congestion vessels. Crupose pneumonia in this. Next picture, microabscess of the lung. So this you look absent normal alveoli, and this you look a lot of neutrophils, and very often format microabscess in the lung, if patient have pneumonia, for example, bronchopneumonia, this congestion vessels, blood congestion vessels, edema, and a lot of neutrophils. Sorry, I want picture. I will show picture with about alteration, exudation, and proliferation types. If we discuss about inflammation, need to discuss about different stages of inflammation. Alteration, the first, then exudation and proliferation. A lot of time ago, stage one stage only alteration, only exudation, and only proliferation. But now we discuss about alteration, maybe alteration and exudation together maybe go. And maybe exudation and proliferation, and maybe mixed. And this maybe all stage together, exudation and proliferation, for example. And if I discuss about alteration, and this the first format damage and injury of them format pathogen recognition and phagocytosis. In phase of exudation, format outflux of pro-inflammatory cytokines and delivery of effector cells of the site of damage and destruction of the pathogen in the stage of exudation. And stage of proliferation, and this format reparations, and maybe full reparation, maybe unfavorable outcomes. For example, if a patient have bigger inflammation, for example, fibrinous inflammation, and this may be a format maybe format not normal cells, and maybe format in this connective tissue, because not full reparation, not full recovery in this. And what reason maybe of injury of cells of tissue? Now, for example, have discussed about alteration. Now, if you remember, have discussed about remember a topic of necrosis and topic dystrophy. I, teacher, had discussed about different pathological factors. Or, for example, remember about exogenous factor and endogenous factor for alteration of cells, damage of cells, injury of cells. For example, exogenous factors, physical, for example, radiation and electrical energy, high and low temperature, for example, burns, yes, and around format inflammation, maybe tissue around with necrosis, tissue died, and around format zone with inflammation, and maybe injuries of various genesis, chemical, for example, acids, alkali, medicines, injury of cells, and especially turpentine and croton oil, for example, the chemical, and biological, for example, microbes, for example, staphylococcus, streptococcus, pneumococcus, and colibacilli, and etc., viruses, and endogenous factors. For example, chemicals, cause inflammation of the site of their release. Or for example, uremic toxins causes by fibrinous enterocolitis. For example, a patient have disease of kidney. For example, glomerulonephritis. and format in future format renal failure and present a lot of uremic salt. And in future format changes in all organs. Format fibrinous pericarditis very often, peritonitis, fibrinous peritonitis, fibrinous pleuritis, dermatitis, and fibrinous enterocolitis, and maybe format different factors. For example, bile and bile acids, uric acid salts. For example, we discuss about gout, and these factors, different factors present in this. Why format alteration? Why format alteration? No, this I have shown a picture and have discussed about it. I want questions for, after you. Write me please in WhatsApp questions, your questions. Okay, if not questions, I send questions for you, and you answers me in WhatsApp or maybe written in YouTube. No, the better in WhatsApp. Okay. I sent message for you in WhatsApp, and you answers me on my questions. Okay. The first questions. Definition of inflammation. I written for you. Definition of inflammation. So I sent for you the first questions on the definition. All students write to me please of definition. Answers now. I sent information. I sent questions for you. Answers, please. Who answers me? Who present? Who absent? Not answers me in WhatsApp. Five minutes for answers. All students. Okay, okay, Serena. Okay, thank you very much. Okay, month. And damage. Lecture. Okay, information part of the body. Investigation. Okay, different answers. No, but for me, okay. Complex biological irritants, pathogens, No, and this full answers. Okay, thank you. Two students answers me. Only two students. Students answers me. Okay. Okay, thank you. Three students is the process by which your bodies white blood cells and okay. Triggers inflammation. Okay. Okay. Regular tissue. Okay. Okay, thanks. Continue. Continue. Okay. Thanks. Okay, Nadi. Okay. Inflammation is evolutionary protective vascular. Okay, thanks. Okay, very good. 5 students. Okay. Answers 5 students. Only 5 students present on the lecture. Why? Continue. Next questions. Where localization of inflammation? Next questions. I'm writing in next questions. I'm writing in WhatsApp. Next questions. Okay, thank you. Next questions. Start of inflammation. Who present on lecture and answers me? Plus Max in practical class. Where start of inflammation? Where? What need? Mainly macrophage. Stages. What is the mean of stages? Stage. Okay, my answers. Okay, just 1 minute, please. Maybe phase, maybe stage. Будет, подойдет.
Хорошо. А какие примерно он подойдет?
Я думаю, что скоро.
Хорошо, спасибо.
Okay. Stage, maybe have discussed about phase. Stage, phase, similar notions. Period, maybe. Okay, acute swelling stage. Okay, not. If you look lecture, if you discuss about lecture, acute, this we discuss about exudative inflammation. If we discuss about acute inflammation, in practical class, if you want, I'm show a picture and have discussed about acute. And this is a different time and development of inflammation. If acute, few time, And if, for example, if chronic inflammation, this may be week, maybe month need for development of full inflammation. And this, okay, answer only my questions. Answer only my questions. My questions. Okay. Okay. What? Okay. I sent. I'm repeating with my questions. You don't understand my questions? Not. No. Students have questions about you mean stage? Not stage. I have discussed about start where what need for inflammation mechanism. For me, need mechanism. Okay, I sent mechanism of development of inflammation. Mechanism of inflammation need for me. Mechanism. What need? Three part of inflammation? What need for inflammation? For example, I have discussed about bone marrow. For example, about vessels, about loose fibrous tissue. For example, it. Yes. And microvessels, yes. And what need? Why format inflammation? Why activated macrophages? What? Write in me about it. Why format inflammation? What changes format in macrophages? Activation of immune system in response to a broad range, consistent cascade immunological, physiological, and behavioral process. Immune signaling molecules called cytokines. Yes, of course. Mobilization of leukocytes. Okay. Good. Best of the best. Who best is the best from my student who answers me? Only 5 students, or maybe more. Microenvironment, hemattraction of leukocytes. What's name of tissue? What's name of cells? What? Name of cells. Name of cells. Of cell. You write in me cells of microenvironment. Mast cells. Okay, very good. Okay, thank you for your answers. Continue. Mast cells. Yes, of course, mast cells. Okay, continue. Okay, mast cells. Okay, next questions for you. Okay, mast cells. Okay, very good. Your answers correct. Okay, mast cells. Nadi. Okay, thank you for your answers. Thank you. Okay, continue. Next questions. Next questions. Okay, type of special inflammation. Special inflammation. Inflammation. Next questions of special inflammation. Next questions. Next. Continue, please. Write in WhatsApp, please. Okay. Type of special inflammation. Have discussed about it. I'm look at screen. Absent answers. Okay, you writing. Only name. Not science. Not science. Not science. Not science. It's clinical symptoms. You write in me about clinical symptoms. Not rubber color, tumor, and dollar. Not answers. It's clinical symptoms. For me, need types. Okay, acute and chronic. Not. Okay, understand. For me, need special. If you look and I'm sure. But for example, look at screen. Look at screen. Look at screen, please. For example, I say about catarrhal inflammation, Icharus inflammation, and hemorrhagic, water present mixed, very often mixed. Yes. Answer serine is correct. Serine, okay, it's very good. Best of the best. Inflammation. And this clinical symptoms, write in me. Clinical symptoms. Yes, of course. Yes, serine is 5 together. 5 today. For your answers. Okay, thank you very much. Continue. The first place for serine. Continue. For example, what is it? I show picture and you write in organs. Name of organs. Name of organs. And type of inflammation. And type of inflammation. Not answer. Oh my God! No, not abscess. Not abscess. No. If you listen me, I told about it, what name of organs and type of inflammation. Remember? Serous inflammation, yes, correct. Of stomach, yes, of course, stomach, yes. Yes, of course, stomach. By 3 days. What is it 3 days? I don't understand why 3 days. Stomach, organs is the stomach, and inflammation, serous inflammation, yes, of course. Okay, continue. Few questions for you. For example, next questions. What describe this picture? Its picture. What describe? Effector stage delivery. Maybe. No, this if we discuss about what changes, what in vessels, and name of process, name because of the with epithelial sites. Okay. Okay, thank you very much for your answers. Sirin, you have today 5 and the first place between of all students, and you have good marks on practical class, plus marks in your my practical class. Thank you very much. Okay, for Sirin and Leka says, Sarlan, okay, it's very good. What changes format in vessels during inflammation? Next questions. Next questions. Okay, questions. Next questions. Continue. What? Okay, during inflammation, format, inflammation in vessels. Extended. Okay, thank you very much. Yes, extended. And okay, thank you very much. Okay, finish of my lecture. Thank you very much who present today in lecture. I say bye bye for you, and thank you for your attention. On productive note, if we discuss about productive inflammation, the next lecture you have discussed about productive inflammation, and on practical class I am show picture, I am show micro slides, I am show gross specimen with different types of inflammation. Now finish of lecture. Thank you very much. Thank you. Bye bye, my dear students. Have a nice day for you. Bye bye. Oh boy.